Hello, my name is Tiffany and today I will be introducing and teaching an oral hygiene method that is most suitable for my patient's needs. Today, after your appointment, you had low plaque levels, type 1 embrasures, which is due to having healthy tissues, and you also have high compliance due to you brushing regularly, and you also have no recession.
Nice.
So one hygiene device that's most suitable for you is going to be string floss because of the low plaque levels, the type 1 embrasures, and the no recession. So first we're going to start with floss. We're going to measure 12 to 15 inches of floss or the length of your forearm. So you're going to pinch here. You're going to go the whole length of your arm, and then you'll cut off here. Next, you're going to hold the floss with your thumbs and index fingers. Wrap the floss around your middle fingers in the middle. And then we're going to hold for the maxillary, hold the floss between our thumbs and the side of our index fingers. And then we're going to, if I could have you hold this model for me.
Ooh, fancy.
Okay, we're going to start on the top. Okay, so we're going to start in the most proximal areas. We're going to start by slowly, for the back tooth, there's no contact, so you just go straight here behind it. You're just going to use the fingers, and you're going to go down below, and you're going to make a C shape around the tooth, and then you're going to go up and then back down. Then you're going to move on to the next tooth, and we do this just so we don't snap the floss into the contacts. We're going to use that sawing motion since this has a contact, so we're going to slightly put it in here. Next, again, we're going to curve the floss around each tooth, creating a C shape. We're going to press the floss firmly against the tooth and move gently to below the gingiva. We're going to repeat the up and down motion with slight pressure.
Okay.
Then we're going to move to same contact sawing again, and we're going to do the mesial. So you go up and back down.
Okay.
And then just take it out like that, just so you don't snap the floss out. When you're doing this, you always want to start at the distal of the most posterior tooth in each quadrant, and then you're going to move to the mesial surface and so on for each tooth in each quadrant. So we're going to go every single quadrant and every single tooth. A sawing motion down the C shape, mesial, back up. Then for each tooth, you're going to move to a different section of floss, that way it's clean.
Okay.
I'm going to use that sawing motion down around the tooth.
Oh, so that's why we have to use such a big piece.
Mm-hmm. Here we go. We go down again with the sawing motion. Sawing motion down C shape and slight pressure. Sawing motion down. We're going to repeat this for the entirety of the mouth. Tight contacts, you just want to go even slower down so you don't snap that floss into the contacts.
Okay. So you can hurt the gums that way?
You can. After I show you all of the teeth and how to floss, we'll go over some injuries that can occur.
Okay.
Okay, and next we're going to go to the bottom. Start at the distal again of every quadrant.
Okay.
Saw C shape.
Just work your way forward.
Right, so you're going to use sawing motion, C shape around the distal, C shape around the mesial, and back up. Sawing motion slightly into the contacts below. You want to make sure you go below that gum tissue. Those tight contacts, you just want to go even slower just so you're not snapping that floss in there.
Yeah, I think sometimes I press too hard because
Yes, and that can cause injuries. I've got a couple photos I'll show you here today on why it's really important to not snap that floss in there. Go down again. You can use your other fingers out here also as like a little rest. Go saw.
Nice, doesn't seem too bad.
Right. This is gonna help you clean, so you make sure you get below all the gum tissue. So for the injuries that can occur, they're primarily found on the facial and the lingual surfaces. So that's gonna be your cheek side and then also your tongue side. They're gonna be directly beside or in the middle of the papilla, which is the gum tissue, and it will appear as a cut beginning at the gingival margin. So this is what a floss cut looks like. Right here you can see this reddening.
Wow.
Yeah, it can be painful. And then floss cuts can also turn into floss clefts if the tissue is repeatedly injured. It will look like a V-shaped notch in the gum line that can lead to gum recession.
Ouch.
So right here you can see on the front teeth there's a little
wow.
V-shaped cut here. This patient flossed too hard. And the causes for this is too long a floss during insertion. So you want to make sure you have that 12 to 15 inches of floss. The snapping the floss through the contact can also cause those cuts and clefts, and then also not hugging the tissue tight enough, which can cut into the gingival margin when moving up and down.
Okay.
All right, do you need any clarifications today?
No, I think I'm...
All right, I'll have you go ahead and
It's pretty
demonstrate for me.
straightforward.
I'll have you measure that floss out for
All
me.
right, let's see if I'm a professional here. Okay, so grab a little bit, length of the forearm. Okay, and then
Between the pointer finger and the thumb, and then you're gonna wrap it around the middle finger.
wrap around the middle finger. Okay,
Pass your knuckle back here just so you get a tight hold on it.
both middle fingers.
Yes.
Okay.
And then you'll be able to use, and maybe go one more just so you don't have too much
Oh,
floss.
that was a little bit shorter.
There you go. Yeah, that way you have more control over it.
So start in the back and
That
make sure in the C shape.
Mhm.
And kind of go up and down a little bit.
Yep, just right.
Okay, so not like back and forth, just
Up and down.
all right. Whoa. All right.
I want to use, right down in there, that nice sawing motion so you don't snap the floss in there and cause its injuries.
Nice. Seems pretty straightforward.
Yep, and then you will just continue to do this for the entire mouth. Do you have any clarifications or do you need anything
No,
else?
I think that's pretty straightforward.
Okay, great.
I'm a professional flosser
You
now.
are.
Hey, look at me go.
And that's it for today.
Yeah.